we've learned in the last few years that the gut microbiome composition seems to be correlated with how a cancer patient responds to immunotherapy with immune checkpoint inhibitors. It turns out that patients who are responding, if you look at the composition of their gut microbiome, their microbiome seems to be more similar to each other than patients who don't respond. And those patients' microbiome tend to be more similar to each other. And so this provides an observational evidence, really, that microbiome may be important in response to immune checkpoint inhibitors. Also, recent studies that show the composition of microbiome can be also important in patients, the toxicity patients experience after immunotherapy. And so this makes makes complete sense in terms of science, because we know that gut microbiome can affect systemic immunity. And we know that immune checkpoint inhibitors actually work through the immune system. So if microbiome on one hand can impact the immune response, and we know the drugs we're giving these patients work through the immune response, so one can put two and two together and think that, okay, maybe changing the microbiome prospectively can help to improve patients' response to immunotherapy. And that's exactly what we did in our study.